Lady Michelle Obama wowed us again this week with her beautiful ball gown and her incredibly toned arms. She continues to influence American fashion styles, especially the trend of sleeveless dresses and gowns. But for a lot of women, flabby arms are keeping them covered up. Dr. Stephen Hopping joins us this morning with what can be done to change the shape of a woman's arms. And good morning to you.
Good morning, Barbara.
And we know because a lot of people try very hard to get those toned arms and they just can't do it. Exercise is sometimes not enough. So, what's the answer?
The answer, well, to quote President Obama, women want the right to bear arms, B-A-R-E, and sleeveless is in, no question, and he's right. Unfortunately, lots of times it's genetic, it's inherited. So it is, you have to work out, you have to maintain your weight. Michelle Obama, she respects nutrition, she respects exercise. So that's the first thing to do. But beyond that, there's still a problem for many women. If you've lost too much weight, you have to have a brachioplasty, which is surgery. But there's some new techniques, and a recent study by the American Academy of Cosmetic Surgery shows that arm surgery, arm liposuction, especially with the new laser liposuction, is up 25% over the past 2 years.
Well, that's
because of this phenomenon of going sleeveless.
And I was going to say, that's because the fashion is, and probably because of First Lady, you see it on television, women who used to only wear jackets they're going sleeveless now, very often.
It's definitely in. So a lot of people are coming in, they don't have the big scar. Fortunately, using laser-assisted liposuction under local anesthesia, we can get 25 to 50% improvement in a lot of these patients. Why? Because the arm elasticity, as you can see in this picture, is very good. The arm elasticity, the skin, can contract after these procedures. So these advanced liposuction procedures can give you results like this. Again, it's not for everybody. People who've lost a lot of weight who have really poor skin elasticity still have to do the old surgical approach.
Well, I think that's what many people probably would be concerned about, is having sagging skin after having all the
Exactly. And some people do have to do the old-fashioned brachioplasty. But this is exciting, and patients are very happy with the surgery, and it's up 25% over the past year.
So should a person be in good physical condition anyway, or can you go in if you haven't been exercising and trying to get those arms out?
Sure, absolutely. We tell everybody, nutrition, exercise, do these things first, okay? And even after you do have the surgery, it's important to maintain the improvement by doing exercise, doing things you can do that'll tone your arms. But unfortunately, for a lot of women, and this is a big problem for women, I would say 90% of women have this issue. These less invasive surgical procedures are now available for those people, and they don't have to go through the big operation.
And so you don't have to be put to sleep for this? It's done
No, you can do this
awake?
under local anesthesia.
And can you go right back to work afterwards?
Well, you have to wear a garment, but you can do it on a Thursday, go back to work on Monday. Now you're bruised and you're wearing a garment, like a leotard on your arms, but, under your clothes.
How expensive is this type of surgery?
Runs about $5,000 with the operating room and with the laser technology.
For both arms?
Right,
all right,
for both arms.
Seems like a high price to pay for thin arms, but I guess if you can look like Michelle Obama, and we're not saying that's how she got hers.
No. I think Michelle, she got hers genetics and exercise. So now it'll be bangs. Lastly, Michelle's influencing everything.
Well, yes, we got the bangs.
Yes.
Thanks a lot, Dr. Hopping. Always
Pleasure.
great to
Have a
see
great
you.
weekend. Watch
Thank
the snow.
Thank you.